Enhancing healthcare in rural Saskatchewan is the focus of a new primary care model study by the province. The first step is the investment of $3.6 million to assist 8 primary healthcare learning sites. These include Yorkton, Meadow Lake, Lloydminster, Regina Inner City, Moose Jaw, Fort Qu'Appelle, Whitecap Dakota First Nation, and Leader. Although the actual dollar amount for the Cypress South Region's test site in Leader is unclear at this point, CEO Beth Vachon indicates the study will be beneficial for Leader and area residents.
Back in the fall, they had asked us where we felt that we had communities that were ready to move forward with the primary health care model. And of course, in Leader, we already have primary health care established in that community, but we've been doing a tremendous amount of work really looking at, are there things that we can do within that model, and how do we include then our entire healthcare team as being part of that, as opposed to just the nurse practitioner and the physician at this point.
Vachon further adds that using technology will also be a focus of the primary care test site in Leader.
We will be looking at telepsychiatry, so looking at how our psychiatrists may be able to spend less time driving and more time seeing patients. So telehealth will never replace all contact, but there are some really good examples of where it's been successful, and psychiatry is actually one of them, and that's where we'll be leading out from Leader, is testing how we can utilize telehealth through psychiatry better.
And when asked if a primary care model could work in other hospitals across the region, such as the community of Shaunavon, which is currently going through its own healthcare hurdles, Vachon had these comments.
Oh yeah, absolutely. Again, it's really about, is the community ready to accept a new model of care or something different, and there has to be significant community input into that. And that really is one of the key factors of whether or not we're successful in a community in changing how we provide health care.
Exactly how the $3.6 million from the province will be divvied up between all the primary care sites has yet to be determined. The actual dollar amount for each health region is expected to be announced in the coming weeks.